Okay, let's continue on with this GI. We're going to talk about diverticulosis, diverticulitis, and then also talk about celiac disease. So they should be very quick. So diverticulosis is what we see here on the bottom left-hand side of the screen. And here we just have pockets or pouches that have formed almost like hernias, where the muscle wall on the intestinal tract is weak, and so it pushes out. So if this is the outside, which it isn't, but let's pretend this is the outside. On the outside of the intestinal tract, you might see a raised bump, and that would be the pouching out of these internal pouches. So with all of our GI, food, nutrition, everything coming through here, you can see how things can get maybe stuck in here, stuck in these pouches. If we have a good balanced diet and lots of fiber though, the fiber itself should be able to, would go in and then bring everything out. And that is actually diverticulosis, which is the weakening of the intestines that form that pouch. And it's just a genetic occurrence that happens, and it really isn't a problem until it becomes inflamed. And it becomes inflamed by having those pouches get filled with substance. It could be food, nuts, stool material, anything at all that gets trapped in here. Can cause an inflammation of that pouch. And then once it's inflamed, it can also block off the exit points of the pouches, and inside then gets bacteria that can turn into infection. So these pouches can be filled with pus matter and cause extreme pain because of that inflammatory process. It would be very sharp intra-abdominal pain that the patients feel, and it is quite painful. The treatment for this is just fluids, pain meds, and broad-spectrum antibiotics. There are other things that you'll learn about in med-surg if it becomes extreme. But they can have these just all over their intestinal tract, and it can be bunched up in one area or it can be bunched up in another. But again, this is autoimmune, but what we're going to be dealing with as the clinician is the inflammatory process and making sure that we control the bacteria, control the infection if they have one, or give prophylactic antibiotic treatment. Okay, so lots of fluid to try and get this out. They would be in NPO status to try and also get this out. Okay. I just want to comment on a change in practice for diverticulosis, which is they used to say no rice, no seeds or nuts, because they felt like they could get trapped in here. And they've actually changed their minds now, saying that there's anything can get trapped in here. It's not just seeds, and it's not necessarily an increased number of the products that they used to say that people could not eat. So they have changed their mind on that. The biggest thing is if it is not inflamed, that they have a high fiber diet. Celiac disease. So with celiac, again, autoimmune, cause unknown, inflammatory process, kills the villi in this case. So it flattens the villi out. When we have nice tall villi like this, we have a increased surface area to absorb fluid and minerals and nutrients. And the gluten that we eat with celiac is not an intolerance, but it is in autoimmune disease. So it attacks the villi that we have in our intestinal tract, and it flattens it. So now we have a much smaller surface area, and if we keep eating gluten, we're going to have increased inflammation and then decrease in absorption of nutrients and fluid. So the patient can very much be malnourished and dehydrated. But the nice thing about this is that all they have to do is avoid gluten. There's no treatment for it. Now, gluten is not just flour, it's wheat, rye, barley, and sometimes oats. And it's not just avoiding a piece of bread. It is making sure that it's the items that you're eating are not cross-contaminated. So a good example of this would be if you go to a restaurant and they are cooking the hamburgers and grilling the hamburger buns on the same grill, then you would not be able to eat the hamburger. Or if they're frying anything coated or chicken nuggets or something in a fryer in a restaurant, but they cook their French fries in that same fryer, then you could not eat that. So cross-contamination can be very slight and will cause this. However, if they do avoid gluten, then that allergic response goes away, that anti-inflammatory goes away, and your villi will start to grow.